Well, let us now proceed to this training of assisting with prescribed medical equipment, supplies, and devices. Remember that this is one of the tasks that you may be allowed to work with your client as long as those are stated in a care plan in beyond personal care. So this time, the goal is to prepare you to assist clients with a variety of equipment, supplies, and devices that are prescribed to assist the client with ambulation, elimination, or respiration. So what are prescribed equipment, supplies, and devices? Prescribed medical equipment, supplies, and devices assist the client with basic bodily functioning. Medical equipment may be prescribed to assist a client in mobility or movement. This equipment helps the client to ambulate, walk, or to change positions. Examples are canes, walkers, and Hoyer lift. This may be prescribed preventing skin breakdown. This equipment helps the client to regain or maintain healthy skin that is free of sores, wounds, or swelling. Examples are bandages, sheepskin or lamb's wool, water mattress, or gel padding. In elimination, this equipment helps the body to eliminate waste from the body to void urine and stool. Examples are enemas, dutches, and catheters. And during respiration, this equipment helps the client to breathe. Examples are oxygen tanks, nebulizers, or CPAP machines. Why are prescribed medical equipment, supplies, and devices important? There are three caregivers who share their stories about why prescribed medical equipment, supplies, or devices are important for the clients they assist. After we read this together, we will answer the questions together too. Okay, first is Miguel's story. Miguel says Mr. Ricardo's ankles were swollen after his surgery. It was uncomfortable for him and it made it difficult for him to walk. Mr. Ricardo was very frustrated by that. The nurse showed me how to apply ace bandages around his ankles, and this helped and swelling go down away after a few weeks. He's so happy to be up on his feet again. Discussion questions that we will discuss it later. How was Mr. Ricardo feeling at the beginning of the story? What equipment, supply, or device was prescribed to help him? How did Mr. Ricardo feel about using this equipment, supply, or device? Next is Carla's story. Miss Elena was on medication for a few months that made her constipated. Once she went 2 weeks without a bowel movement. She was so uncomfortable. Then her doctor prescribed an enema for her, and I assisted her with it. About 10 minutes later, she was able to have a bowel movement. She felt so much better afterward. The questions that we will discuss are how was Miss Elena feeling at the beginning of the story? When equipment, supply, or device was prescribed to help her? How did Miss Elena feel after this equipment, supply, or device? Why? Oh, okay. Next is Liliana's story. Mrs. Sanchez has a lot of mucus that builds up in her lungs. It used to make her cough a lot, and the coughing made it hard for her to sleep. Her doctor just diagnosed her with chronic obstructive pulmonary disease, and he prescribed a nebulizer for her. This is a machine that she uses to inhale a medicine that breaks up the mucus. It really seems to help her. She does not cough as much now, and that means she's able to rest. The questions are How was Mrs. Sanchez feeling at the beginning of the story? What equipment, supply, or device was prescribed to help her? How did Mrs. Sanchez feel after using this equipment, supply, or device? Now, let's go to what is skin. The basic information about skin and medical equipment prescribed to prevent skin breakdown. Skin is the barrier that covers the outside of our bodies. Why is skin important? Skin it protects the side of the body from germs. It also helps the body maintain the right temperature and the right amount of water. And then what kinds of condition can cause skin breakdown? We have wounds, pressure sores, edema, swelling due to injury. And what medical equipment might be prescribed to prevent skin breakdown? Dressings or bandages on wounds or sores. Elastic bandages or ACE bandages. What will your role be in assisting the client with this equipment? You may apply an elastic bandage under special circumstances only. You will not apply or change dressings that need to be sterile. Apply or change dressings on skin that is not stable. Okay, I will read this skill checklist number 1 that deals with assisting with an ACE bandage. Before explain the procedure to the client. Wash your hands, gather the equipment and supplies you need. ACE bandage, clip, tape, or safety pin. Make sure the area to be wrapped is clean and dry. Position the client to apply the ACE bandage. Apply the ACE bandage. Make sure that first the bandage is in the place that the care plan indicates. The bandage is snug enough to stay in place but not so tight that it will decrease circulation. The bandage is secured with a clip, tape, or safety pin. Do not tie the bandage. Observe and feel the part of the extremity that is below the bandage. Note the temperature and any changes in color. Note any sores. Note if the skin is swelling or shiny and tight. Note any dryness of the skin. Wash hands and observe, record, and report. Now, let's go to basic information about elimination and medical equipment prescribed for it. What medical equipment might be prescribed? Oh, by the way, let's go back. What is elimination? Elimination is how the body gets rid of waste. The body eliminates liquid waste in urine and solid waste in stool. Why is elimination important? When a person eats, the cells of the body absorb the nutrients that they need in order to function. The body needs to get rid of anything that is not absorbed. When the body cannot control the elimination of urine, this is called urinary incontinence. This may cause inconvenience and emotional distress. It can also contribute to skin breakdown. When the body cannot eliminate solid waste or stool, this is called constipation, and this may cause a person pain or discomfort. What kinds of condition can lead to problems with elimination? First is aging, surgery, medications, cancer, and lack of exercise. So what equipment or what medical equipment might be prescribed? An enema. It is a procedure that introduces liquids into the rectum and colon through the anus. There are different kinds of enemas. The two you may be asked to assist with are a commercially prepared enema, a soap solution enema. A douche, this is a procedure that introduces liquid into the vagina in order to help keep it clean, also refers to the equipment used. A catheter is a thin tube inserted into the body that is used to drain urine from the body. A condom catheter. It is a catheter that has a covering that is placed over the penis. This kind of catheter is also called an external catheter. A urinary drainage bag. A bag at the end of catheter tubing that is used to collect urine. What will your role be in assisting the client with this equipment? You may assist with the use of an enema, assist with the use of douche, and assist with cleaning the skin around the catheter, assist in cleaning catheter tubing, assist with emptying a urinary drainage bag, assist with the use of condom catheter, but as a caregiver, you may not insert any tube, a catheter tube, for example, into any opening of the body. Okay, now we have to go to skills checklist, how to assist with the use of commercially prepared enema. Explain the procedure to the client and wash your hands. Gather the equipment and supplies that you need. The enema, bedpan, or commode if necessary. Toilet paper, waterproof, bed protector pad, soap, wash basin if necessary. Put on gloves. Assist client into position directed on the care plan. Place waterproof pad under client's buttocks. Place blanket on client so only the rectal area is exposed. Remove air from the tip of the enema applicator. Enema is administered slowly, done by aid under special circumstances only. Put the used enema applicator back into the box tip first. If the client has used an oil retention enema, remind client to hold the enema for the time ordered. Help the client onto bedpan or assist client into bathroom or onto commode. Remind the client not to flush the toilet. Check on results of enema. Observe the enema results for color, amount, odor, and consistency. Assist the client to clean self, if necessary, including wash hands. Remove the waterproof bed protector. Empty and clean the bedpan or commode pail. Dispose of used enema applicator. Remove gloves and throw them away. Wash hands. Help client into a comfortable position. Observe, record, and report the use and results of the enema, including the amount of stool, whether or not the stool was hard, streaked with red, or was very dark, and if client had difficulty administering enema or was unable to tolerate the enema because of cramping. Observe, record, and report any changes in condition or behavior. Let's go to assisting with the use of a soap solution enema. Explain procedure to the client. Wash hands. Gather the equipment and supplies you need. The enema bag and tubing, clamp, measuring container, bedpan, lubricant, toilet paper, and commode if necessary. Put on gloves and then prepare the enema. Close the clamp on the enema tubing. Adjust water flow from the faucet. Fill the measuring container with water to the quart mark or as ordered. Check temperature of the water on wrist. Prepare the enema solution as directed by the care plan. Pour the solution into the enema bag. Seal the top of the enema bag. Hang the bag at the height directed by the care plan. Position the client as directed by the care plan. Place the waterproof pad under the client's buttocks. Place blanket on client so only the rectal area is exposed. Position bedpan so it is behind client. Position the enema tubing over the bedpan and open clamp to allow the solution to flow through the tubing to remove air. Reclamp the tubing. Lubricate the tip of the enema tubing with the lubricant. The enema is administered by the aid. The aid never does this step. After the enema has been administered and the tubing has been removed, wrap the tip of the tubing with paper towels and place inside the enema bag. Help the client onto bedpan or assist client to the bathroom or bedside commode. Remember the client not to flush the toilet. Assist the client in cleaning self if necessary. Okay, now let us proceed to basic information about asthma. What is an asthma? Asthma is a disease that affects the airways that carry air to and from the lungs. In people with asthma, these airways are swollen or inflamed and become narrow so that less air can pass through them. People with asthma tend to be very sensitive to irritants in the air, like pollen or pollution. Up to 80% of people with asthma have allergies to airborne irritants. What are the symptoms of asthma? Wheezing or a hissing sound when breathing, tightness in the chest, coughing, difficulty breathing. What is an asthma attack? This is when the symptoms of asthma are worse than usual. This is often due to exposure to irritants or allergens or because of stress or exercise. These attacks can come on suddenly and may be mild, moderate, or severe. Very severe asthma attacks can be life-threatening. How is asthma treated? There is no cure for asthma, but people can take medications to manage their symptoms. They can also learn what triggers their asthma attacks so that they can avoid these triggers. What kind of equipment, supplies, or devices may be used by a client with asthma? There are inhalers, nebulizers, oxygen tanks with a mask or nasal cannula, sterile or distilled water. Okay, next. Next is COPD. What is COPD? It stands for chronic obstructive pulmonary disease, which is a term used to describe two diseases that tend to coexist, bronchitis and emphysema. These diseases cause the airways to become narrow and the lungs to become inflamed. COPD tends to be progressive, which means that the symptoms become worse over time. And what are the symptoms of COPD? Chronic shortness of breath, acute episodes when shortness of breath becomes worse than usual. And what is the cause of COPD? One cause of COPD is smoking, but it can be caused by long-term exposure to other irritants besides cigarette smoke. And what kind of equipment, supplies, or devices may be used by a client with COPD? We have the oxygen concentrators. And oxygen concentrators the oxygen tanks with a mask or nasal cannula, and mechanical ventilators. I'm sorry. Yeah, the one that it is on the the one that's on the picture. Now let's move to sleep apnea. What is sleep apnea? Sleep apnea is a condition that causes a person to stop breathing when they are asleep. And what is the cause? The cause is it occurs when the muscles in the back of the throat becomes too relaxed while the body is sleeping. This closes the airway, which leads to a shortage of oxygen in the blood. The brain responds to the oxygen shortage by waking up the body just enough to reopen the airway. People with sleep apnea may wake up hundreds of times a night without knowing it. What are the symptoms of sleep apnea? Fatigue and poor concentration. Why is sleep apnea dangerous? It increases the risks of accidents due to fatigue. It puts strain on the heart and lungs. It increases the risk for diabetes, heart disease, high blood pressure, stroke, and weight gain. And what kind of equipment, supplies, or devices may be used by a client with sleep apnea? It's the CPAP machine, the one that is on the picture. Medication nebulizer. It is a medication nebulizer changes liquid medication into a mist that is inhaled through a mouthpiece. The medication is mixed with saline in the nebulizer cup. The cup and the mouthpiece are connected by tubing to an air compressor. Okay, let's go to a skills checklist number 6. Assisting with the use of a medication nebulizer and air compressor. Explain to client what you plan to do. First, wash your hands. Gather the equipment and supplies you will need. Of course, the nebulizer, the saline, clock or watch with the second hand, medication if allowed under special circumstances. Put on gloves. Attach the tubing to the compressor. Add saline to the nebulizer. Ensure that the medication is placed in the nebulizer. This step is done by the aide under special circumstances only. Put the tap back on the nebulizer and attach the mouthpiece. Attach the tubing to the nebulizer and mouthpiece. Assist client to a sitting or semi-reclining position if necessary. Take and record the client's pulse and respiratory rate. Turn on the compressor and check for visible mist from the nebulizer. Remind the client to breathe in slowly through the mouth so that the medication is carried deep into the lungs. The client should hold his or her breath for a short time and then breathe out. Turn off the machine if the client coughs. Provide tissue to the client. Turn on the compressor when the client is ready. Take the client's pulse and respirations during the use of medication nebulizer and observe for a big increase in pulse rate. Observe for signs that the client is not getting enough oxygen. Rapid pulse and respiration, difficulty breathing, cold, clammy skin, blue or darkened lips, fingernails or eyelids, being unresponsive, meaning not responding when you call his or her name. If you observe any of these signs, stop the procedure immediately and call your supervisor. Time the treatment. Turn off the compressor. Take the client's pulse and respiration and record them. Wash the nebulizer and mouthpiece according to the directions in the care plan. Remove gloves and throw them away. Wash your hands. Replace the medication nebulizer and mouthpiece as needed. Record the use of medication nebulizer and any signs of too little oxygen. Report to the supervisor any sign of the client not getting enough oxygen. If the client has an increase in pulse rate, or if the client does not use the nebulizer as directed on the care plan. Now, next is the CPAP machine. CPAP stands for Continuous Positive Airway Pressure. A CPAP machine blows air into the client's nose and throat. The air goes through the tubing and into the mask. The mask covers the client's nose and is kept in place with head straps. The air pressure is high enough to keep the client's airway open while he or she is asleep. When assisting your client with CPAP machine, make sure that the mask is not too tight because this can irritate the face. The mask is not too loose because air will blow into their eyes. The air filter on the machine has air flowing around it. Make sure the machine is not against the wall or too close to the bed. Okay, let's go to this skills checklist assisting with the use of CPAP machine. Explain the procedure to the client. Wash your hands. Gather all of the parts of the CPAP machine. Put on gloves. Attach the tubing to the flow generator. Assemble the valve according to the directions of the supplier and attach the mask. Attach valve and mask to the tubing. Assist the client in adjusting mask and head straps. Position the client comfortably in bed. Remove gloves and throw them away. Observe the client for snoring or sleep interruptions or the need to sit up and breathe. Assist the client in removing the mask after sleep. Take the tubing, mask, and valve apart to clean according to the directions of the supplier. Allow the pieces to air dry. Wash your hands. Observe the client for problems such as runny nose, dry throat, headache, or ear pain. Observe for daytime sleepiness. Record the use of CPAP machine in your observations of the client as well as any problem with the CPAP machine. Report any problems with the CPAP machine or any problems with the client such as runny nose, dry throat, headache, ear pain, daytime sleepiness, loud snoring, complaints of not sleeping well, or of needing to sit up to breathe. So now, let's go to safety precautions to follow when oxygen is in use. Oxygen is flammable. Flammable means that it can easily start a fire or burn quickly. That means that you need to follow safety precautions when oxygen has been prescribed for your client. Remove all flammable materials from the area. Here are some flammable items that you may see in your client's home: cigarettes, matches, lighters, candles and alcohol, nail polish or nail polish remover, electric shavers, hair dryers, or other electrical appliances. Post no smoking or oxygen in use signs. These signs will remind others not to smoke near your client's oxygen. Never permit smoking in the room or area where oxygen is used or stored. Always turn the oxygen tank off in case of fire. Never adjust the oxygen level. Now, we have the parts of an oxygen tank. An oxygen tank has several parts to it. First is the regulator gauge, which shows how much oxygen is left in the tank. The tank valve is the valve that is turned on at the beginning of the treatment and off at the end of the treatment. When the tank is on, the flow meter shows how much oxygen is flowing, the dosage. The reading on the flow meter should be the same as the dosage that is indicated in the care plan. This dosage measured in liters per minute. For example, the care plan may say that the client should use the oxygen set at the rate of 2 liters. Some oxygen tanks have a humidifying bottle attached. This humidifies the oxygen, makes it moist, so that the client's nostrils and throat do not become too dry when breathing the oxygen. The oxygen tube carries oxygen from the tank to the nasal cannula that is secured in the client's nostrils with prongs. Some clients may use an oxygen mask instead of nasal cannula. Now, let's go to a skills checklist of assisting the client with the use of an oxygen tank and liquid oxygen reservoir. Explain to client what you plan to do. Wash your hands. Gather equipment and supplies that you will need. Oxygen tank or liquid oxygen reservoir, mask or nasal cannula, humidifying bottle if used, distilled water, clock or watch with second hand. Put on gloves if necessary. Check oxygen tank or reservoir, gauge to see if there is enough oxygen. Call supervisor if not. Wash humidifying bottle. Check the humidifying bottle to make sure it has an adequate amount of distilled water in it and the bottle is screwed on tightly. Take and record the client's pulse and respiration rate. Turn on the oxygen tank. Ensure that flow meter is set to appropriate level as noted in the care plan. Regulation of flow meter done by aid only under special circumstances. Check that water in humidifying bottle is bubbling. Check that air is flowing from the mask or nasal cannula. Assist the client in putting on and adjusting the mask or nasal cannula. Cannula prongs go into the nose. Mask should sit close to face but not pinch it. Take and record the client's pulse and respirations. Turn oxygen tank off. Turn the flow meter off. Assist the client in removing the oxygen mask or nasal cannula and wash your hands. Observe for difficulty breathing, rapid pulse and respiration, cold clammy skin, blue or darkened lips, fingernails or eyelids, client unable to sit still, client not responding when you call his or her name, client has headaches or complains of no energy. Record the use of the oxygen tank or liquid oxygen reservoir and observations of the client. Report to the supervisor immediately if the client has difficulty breathing, has rapid pulse and respiration, has cold clammy skin, has blue or darkened lips, fingernails or eyelids, is unable to sit still, does not respond when you call his or her name, who has headaches or complains of no energy. Okay, now let's proceed to oxygen concentrator. Oxygen concentrator is a machine that increases the amount of oxygen in the air that the client breathes. It affects the air in the whole room. It is turned on and off by a single switch. The oxygen concentrator has several parts. The air filter cleans the air going into the machine. This filter should be brushed off every day to remove dust, and it should be washed once a week in warm soapy water. This machine can run without the filter for a short time while the filter dries. The oxygen concentrator dial, it controls the flow of oxygen. This dial should be set to the position that is indicated on the care plan. Some concentrators have a humidifying bottle that puts moisture into the air going through the air tube. This moisture keeps the client's nose from getting too dry. When assisting your client with an oxygen concentrator, make sure that the air filter on the machine has air flowing around it. The concentrator should not be against a wall or too close to the bed. Make sure that nothing is covering the concentrator. The humidifying bottle on the oxygen concentrator is filled with sterile water. You are not permitted to use tap water. Now, let's go to the skill checklist that assists with the use of an oxygen concentrator with your patient. Explain to client what you plan to do. Wash your hands. Gather equipment and supplies you will need, like oxygen concentrator, humidifying bottle if used, distilled water and nasal cannula, clock or watch with second hand, clean air filter, wash humidifying bottle if used. Check the humidifying bottle to make sure it has an adequate amount of distilled water in it, and the bottle is screwed on tightly if used. Attach the air tube to the oxygen concentrator or humidifying bottle. Take and record the client's pulse and respiratory rate. Turn on the switch to the oxygen concentrator. Check the air is bubbling through the humidifying bottle. Check that air is flowing through the nasal cannula. Ensure that flow meter is set to appropriate level as noted in the care plan. Assist the client in putting on the nasal cannula. Take and record the client's pulse and respiratory rate. Turn off the oxygen concentrator. Assist the client in removing the nasal cannula and wash your hands. Observe for difficulty breathing, rapid pulse and respiration, cold clammy skin, blue or darkened lips, fingernails or eyelids, client unable to sit still, client not responding when you call his or her name, client has headaches or complains of no energy. Record the use of the oxygen concentrator and observations of the client and any problems with the oxygen concentrator. Report to the supervisor immediately if the client has difficulty breathing, has rapid pulse and respiration, has cold, clammy skin, has blue or darkened lips, fingernails or eyelids, who is unable to sit still, who does not respond when you call his or her name, and has headaches or complains of no energy. Now, let me have some stories from other caregivers or home health aides. Michelle's story. Mr. Jimenez has asthma. Last month, he had a really bad asthma attack. I assisted him by bringing him his nebulizer, but he still was wheezing a lot. I called the nurse, and Mr. Jimenez went to the hospital. He's okay now, but I am worried that it will happen again. It was scary to see him that way. Peter's story. Miss Martin has COPD, so she needs to use an oxygen tank to breathe. Even with the oxygen, it's hard for her to be able to do many things she enjoys. I wish she did not need oxygen. It makes me feel sad. Janice's story. Mrs. Lowell started taking a new medication a month ago, and it made her constipated. Her doctor prescribed an enema. I felt kind of embarrassed about assisting her with it, but she really felt better afterwards. That made me feel good. Now, what are you feeling right now about your role in assisting with the prescribed medical equipment, supplies, and devices that were discussed in this chapter?